I am Dr. Anil Kukreja, Vice President, Medical Affairs and Regulatory for AstraZeneca India. Thank you for giving this opportunity. There are no standardized or widely implemented screening guidelines for lung cancer in India. There are centers who have really done well and they are following the international guidelines, but those are far and few. At a population level, at a national level, there are no screening programs. And of course, the reasons are that one, there is a lack of awareness of the disease per se, lack of the awareness, particularly realizing that how many lives we are losing, particularly because of the delayed diagnosis. I think that's very important. And it's not priority. Still, lung cancer is not a priority at a national level, despite being one of the most lethal cancer because of the late diagnosis. So there is a lack of push from the general public, lack of priority even from the policymakers. And I think more efforts needs to be done from our side to ensure that one, we enhance the awareness, education, more importantly, make the information available and the resources, which ensures that there is a call for action. And that call for action is to ensure that the risk assessment tools are implemented. We identify and define who are the high-risk patients in India, and then ensure that these patients, high-risk patients, are screened, empowered, and then they go through the screening programs, which will result into early diagnosis of lung cancer, which requires definitely a very holistic collaboration between the private sector, public sector, health insurance coverage also, and more importantly, also ensuring that all the stakeholders work in a complementary and synergistic manner to ensure that these screening guidelines are implemented. So those are my perspectives. Yeah, that's a very good question, actually. And that's the reason why there should be all the more attention to be paid for early diagnosis. Now, if we look at the outcomes of lung cancer, if the lung cancer is diagnosed early, you have a significantly better outcomes compared to when the lung cancer is diagnosed late. So lung cancer still remains the number one cause of death globally and fourth most common cause of cancer-related death in India. There has been a significant improvement with the arrival of new treatment options. Particularly, I will call out the targeted treatments based on the biomarker diagnosis and also the immunotherapy. So both the targeted treatments and immunotherapy has definitely improved the survival of patients in lung cancer. But there is a huge opportunity I see that how can these targeted treatments and immunotherapy is used in the earlier line setting so that we potentially treat the patients with the curative intent. And that's something which makes all the more the early lung cancer diagnosis almost kind of a call for action for all the stakeholders who are working in the healthcare sector. I would say each one of us who's now interacting also is a kind of a patient advocate, right? We are trying to see and bring the voice of patients on the table. And cancer patient advocacy has a huge role to play. They play a crucial role in providing the support to the patients, empowering the patients through education, and providing the resources to the patients, which is from the diverse nature of resources. It could be an educational resource, it could be a diagnostic resource, it could be a treatment resource, it could be a palliative support resource. More importantly, the patient advocacy groups bring the voice of patient on the table. They definitely improve the cancer care. They improve the research funding, and most importantly, access to the quality healthcare services for patients in India. So they do definitely contribute in shaping the policies for cancer care. In terms of patient advocacy in India, I would say it is there as an individual caregiver, I would say individual patient activists are there. But there is a need for more systematic and holistic, structured patient advocacy groups who are really committed and passionate about transforming the landscape of, say, lung cancer in India. So we really need groups. Of course, there are efforts from various quarters to bring such kind of patient advocacy to the fore. So those efforts definitely will help us to move in the right direction. And I think we should continue those efforts from our side as well. I think the starting point should be the awareness, most important. Public awareness about what's the impact lung cancer is creating for policy change. And need is to educate the public, policymakers, healthcare professionals about the burden of disease, the mortality, the risk factors, and most importantly, the need for early detection, and which is crucial for improving the long-term outcomes. And that's really important for us. Of course, we need to mobilize the patient advocacy groups. We need to ensure that we collaborate with them, leverage their expertise and the networks, ensure that we work very, very closely with the medical societies, the academic medical societies, the top key external experts from academic institutes. Those are important for making a policy change. I would say sometimes we need to also generate the data. We need to generate the data on the epidemiology, the burden, what are the unmet needs, and how best the unmet needs can be prioritized and encouraged. And significantly important part of the policy change also is how does the policy take care of the access also? Access to the quality biomarker diagnostics and also access to the treatment options, so that we are able to demonstrate the improvement in the patient's outcome with both these access initiatives. But the starting point, I would say, is awareness. So from awareness, we move to diagnosis, we move to treatment, and more importantly, continuation of the treatment. And that will all improve the early diagnosis as well as the long-term outcomes for the patients. I think most important message is we need to identify the most important culprit for the causation of lung cancer. And we all know the smoking does play an important role, and tobacco-related diseases are very frequent. And it's important that we take a cognizance about prevention of these diseases also. So as a nation, I think it's important that we take the resolve that on this World No Tobacco Day, it's important that we become a health ambassador to ensure that we communicate the messages within our own homes, within our communities, within our larger, I would say, networks, to ensure that we contribute in making the world a better place to live. And therefore, I think the use of tobacco and other things should be avoided and should be stopped, should be, in fact, I would say, levied heavy taxes so that we can use the same taxes to take care of the awareness, diagnosis, prevention, and treatment part. So I would say we have to, as a government, and also more importantly as a citizens, we should be asking for the right measures to be taken on this important day.